Behavioral Sciences Lecture 7, Psychological Disorders. Understanding psychological disorders can be very difficult, and there are many approaches to doing this. The biomedical approach takes into account only the physical and medical causes of the disorder. Because of this, treatments are often biomedical, so pharmaceuticals or medical treatments. The biopsychosocial approach, on the other hand, considers the relative contributions of biological, psychological, and social components of a disorder. It's more overarching in its view, which leads to more diverse treatments, which can include therapy on top of other medical treatments. Currently, psychological disorders are diagnosed using the Diagnostic and Statistical Manual of Mental Disorders, or DSM for short. The diagnosis of psychological disorders are based entirely on symptoms. This book is somewhat subjective and controversial because it addresses psychological disorders in a method that is very sterile and standardized. No two individuals are the same. Therefore, how psychological disorders manifest varies. Note that psychological disorders are actually very common in populations. For this next bit, let's talk about some types of psychological disorders. Before we begin though, what is a psychological disorder? Well, a disorder is something that is viewed as abnormal. So a psychological disorder is referring to something that is an abnormal feature compared to what is considered quote-unquote normal. Obviously, this is kind of subjective, so how we classify psychological disorders is really a gray area. The first disorder we'll look into is schizophrenia. This has psychosis as a feature and has positive or negative symptoms. Positive symptoms add to behavior, affect, or cognition. These can be delusions, hallucinations, disorganized speech and behavior, etc. Negative symptoms entail a loss of behavior, affect, or cognition. This could be disturbance of affect and avolition. So a loss of behavior can include seclusion, pulling yourself away, etc. In the upper right, there's a picture that was drawn by a schizophrenic. Depression. Depression is actually very common, and it comes in 3 different types. Major depression contains at least one major depressive episode. Pervasive depression is when you are depressed for at least 2 years and does not meet major depressive criteria. Seasonal affect is seasonal onset depression during the winter months. When there's less daylight, you often get depressed. This is why people in areas that have heavy rain or are largely overcast, like the Pacific Northwest, tend to exhibit more depression. This is largely treatable though, since we have lots of ways to produce light that mimic sunlight. Bipolar or related disorders. These are characterized by mania, which are abnormal and persistently elevated moods. Hypomania is just a milder form of this mania. It's marked by elation and hyperactivity. Dysthymia is a mood disorder that's associated with depression. Bipolar disorders are noted by having extreme ups and extreme downs, with really no warning or no logical explanation why. Anxiety disorders. I'm sure many of us have felt anxiety before, but persistent anxiety is what separates normal levels of anxiety with that which would be considered a disorder. Generalized anxiety is the disproportionate and persistent worry that basically is non-stop and constant. This will lead to hampering of the individual's life, since the worry will just cripple them, and they'll be unable to function as they should. Specific phobias are irrational fears of specific objects or situations. Everyone has phobias, but how we cope with these phobias can either be healthy or something that would be considered disorderly. Social anxiety is anxiety due to social performance or situations. And panic disorders are marked by recurrent panic attacks that are largely onset by anxiety. Obsessive-compulsive disorders are characterized by obsessions, which are persistent intrusive thoughts or impulses, or compulsions, which are repetitive tasks that relieve tension. These manifest behaviors that impair the individual's personal life. These behaviors can include counting, cleaning, or checking. So somebody who's constantly checking to see what time it is, or somebody who's constantly cleaning or washing their hands. These are all behaviors that can really impair a person's well-being. Body dysmorphic disorders are characterized by unrealistic negative evaluations of one's appearance or body part. These often resort in extreme measures to correct this perceived issue. This can lead to eating disorders such as anorexia and bulimia, or, in extreme cases, amputation of body parts that the person feels is unsatisfactory. Dissociative disorders come in different forms. Dissociative amnesia is the inability to recall past experiences without an underlying neurological disorder. Dissociative identity is the occurrence of multiple personalities that control a person's behavior. Depersonalization or derealization involves feelings of detachment from the mind, body, or environment. Dissociative disorders are how they sound. You are unable to associate with your life. Somatic symptoms and related disorders. Somatic symptoms involve extreme anxiety over perceived physical symptoms. Often these anxieties and worries are over nothing. Illness anxiety is a preoccupation with coming down with an illness or serious medical condition, which leads to avoidant behavior. And conversion involves unexplained symptoms that affect motor or sensory function. It's associated with prior trauma. These are often linked with anxiety disorders. There are a wide variety of personality disorders, and they're grouped into 3 clusters. The first cluster, Cluster A, involves odd, eccentric, or weird behavior. For example, paranoia. This is a pervasive mistrust and suspicion of others. Schizotypal involves the ideas of reference, magical thinking, and eccentricity. Basically, these people don't have a very strong grasp of reality. Schizoid is the detachment from social relationships and limited emotions. The second cluster, Cluster B, involves dramatic, episodic, erratic, and wild behavior. These include antisocial behaviors, or disregard for the rights of others, borderline behaviors, instability in relationships, mood, and self-image, histrionic, or constant attention-seeking behaviors, and narcissistic, or grandiose senses of self-importance and need for admiration. Finally, Cluster C involves anxious, fearful, and worried behaviors. These can be avoidant behaviors, which are extreme shyness and fear of rejection, dependent, or continuous need for reassurance, and obsessive-compulsive, or perfectionist, inflexible, and preoccupied tendencies. So, we've gone through some disorders, and I'm sure you saw some similarities between them. Do note that many disorders are linked, so if you observe one disorder, it's very common that you're going to see others. For example, if you have a personality disorder, you may likely have anxiety and depression on top of that. For this last bit, let's go over some biological bases for nervous system disorders. Schizophrenia may be associated with genetic factors, birth trauma, adolescent drug use, and family history. One of the key factors or key symptoms that are noted are high levels of dopaminergic transmission. This often leads to psychiatrists treating schizophrenia by tampering with dopamine levels in their patient through medication. Depression is accompanied by high levels of glucocorticoids and low levels of norepinephrine, serotonin, and dopamine. In the bottom, you can see a brain scan of 2 separate individuals, one that is depressed and one that isn't. As you can see, there is a lower level of activation in the brain. Bipolar disorders are accompanied by high levels of norepinephrine and serotonin. Note, these are highly heritable. Alzheimer's disease is associated with genetic factors, brain atrophy, decreases in acetylcholine, senile plaques, and neurofibrillary tangles. As you can see, there is some degradation between a brain that is suffering from Alzheimer's disease and a normal one. Parkinson's disease is associated with bradykinesia, resting tremor, pill-rolling tremor, etc. In the bottom picture, there are some common symptoms that you'll see in people with Parkinson's disease. There is no clear consensus on the biological basis for neurological disorders. It's something that we're still working on, but these are some proposed theories as to where they come from. With that, let's finish our discussion on psychological disorders. Please join us in the next behavioral sciences lecture.